This PowerPoint presentation is Unit 13, Person-Centred Care in Health and Social Care, and it's part of the BTEC Health and Social Care Certificate. The aims and objectives of this session are that you will be able to describe skills and qualities needed to give personal care. You will identify procedures relating to personal care. You will explain why procedures relating to personal care must be followed. And then you will look at case studies which will enable you to describe the personal and emotional needs of individuals of varying age groups for children and adults. Remember to look out for the green box on the right-hand side of each of the slides to show you which question the slide relates to. Person-centred care troubleshooting. You'll see this slide relates to all of the questions. And sometimes you have to think outside of the box. If you're working in a nursing home where every service user needs personal care and staff have called in sick, you may need to think of different ways to meet their individual needs to get them ready in time for breakfast being served in the lounge. You may only have time to clean one area of each person's body before getting them to the lounge for breakfast. So I want you to think, which area would you clean? Think about what you would prefer. Would you prefer to have your face washed, down below washed, your hands, your arms, or your neck? Now, there's no right or wrong answer here. We all have our own needs and wishes. So this is just to get you thinking about, the things that you might have to do when you're working in the care environment. What is personal care? Well, personal care is a broad term used to refer to supporting with personal hygiene and toileting, also along with dressing and maintaining your personal appearance. So it can cover, but is not limited to, bathing, showering, and this includes bed baths. We're now going to look at privacy and dignity. So what is privacy? So this is giving someone space where and when they need it. And dignity is about focusing on the value of every individual, and this includes respecting their views, their choices and their decisions, not making assumptions about how they want to be treated, working with care and compassion, and communicating directly with the individual whenever possible. And if you remember, we've looked at this, it's about always, if you can, communicating with that individual, because they know what they want and they know what they like and what they need. Privacy and dignity is at the centre of a person's well-being. So as far as possible, you should get to know each individual that you're working with. You need to get to know their background and ideas, their wishes, their likes and dislikes. And again, this is something we've talked about over, some of the sessions. You should always provide personalised care and support that puts an individual at the centre of their care. You should enable them to be as independent as possible and respect their privacy and their dignity. And working in this way reduces the risk of an individual being treated in a way that is degrading or harmful. So how do we respect privacy? In general, these are some examples of ways that you should protect their privacy. So always ask individuals before touching them in any way. Knock on the door or speak before you enter the particular space or the room that they are in. If your role involves supporting individuals to wash or dress, make sure you protect their dignity and privacy by making sure curtains, screens or doors are properly closed. Clothing or hospital gowns should always be arranged in a dignified way. It's important to promote the dignity of all individuals, that they should be fully involved in any decision that affects their care. This includes personal decisions such as what to eat, what they want to wear, what time they go to bed, and wider decisions about their care or support. And again, we've talked about this over some of the other sessions. It is important if we're asking people to all go to bed at the same time. We said before, that's institutional abuse. We need to find out what time do they want to go to bed. However, sometimes an individual may not be able to understand, to be able to make a decision or communicate their choice. So if this is the case, they may lack the mental capacity to make the decision. The individual may be able to make day-to-day decisions, so for example, what to wear and what they want to eat, but not be able to make complex decisions, so for example, about money or medical issues. So here are some key examples that are lack of privacy and dignity. So lack of thought given to helping people with their personal appearance. So, it's really important that you do help people, and if they're not able to make the right choices, so like let's say clothes, you need to help them to make that right choice so they look nice. So, you get to know what that person's appearance, what their taste is. So, you make sure that you give them and you help them with their personal appearance. The attachment of labels to older people, so you may have heard terms such as bed blockers or geriatrics. Exposing a patient's naked body to strangers or to other patients when using a hoist. And as we said before, it's important that you put a curtain around, or you close the door and you make it, so that you're respecting dignity. Not asking the person how he or she would like to be addressed. Mixed sex wards. Lack of thought being given to the gender of the carer, and mixing tablets into food. If they declined it, it's their choice. Okay, so on this slide there's a link to a video clip which I want you to watch. It's in relation to Sophie Wilson, and Sophie Wilson is a young lady who broke her neck and damaged her spinal cord, so has paralysis. Sophie's video demonstrates the importance of promoting independence when providing care. It's so important to focus on what the person can do rather than doing everything for them and presuming they cannot do things for themselves. So watch the video clip before you move on to the next slide. So the next few slides relate to question 1 and question 2, and they contain skills and qualities that are needed when working in care. You need to choose 3 skills and 3 qualities and describe what they are, why they are needed. Now, you'll see a tip here at the bottom. So a skill is something you can do. So for example, I can dance, I can sing, I can draw. And a quality is something you are. So for example, I am kind, I am nice, I am polite. So think of that tip when you're looking and describing the skills and qualities. So here are some skills for person-centered care and some of the skills you would need if you're working in the care environment. So you'd need to have some skills in hair care, make it personal by styling it, how the surface user likes it, and use their hair care equipment. So you would need to be able to shampoo, condition the service user's hair using combs and brushes. Oral care, so ensuring the service users' mouths are clean and fresh, brushing their teeth in the morning and at night, or when requested, and brushing them thoroughly. Dental care, so cleaning them, the ones that use dentures in the denture solution. They must be brushed and checked for cracks each day. They must be placed in the service user's container at night. Some more skills, so skincare, so you must check the integrity of the skin to check for sores, wounds, thinning skin and rashes. Bathing, so you need to encourage independence but offer assistance when required on hand to reach certain areas. You can bathe service users in a bath or in a bed. Maintaining privacy and dignity, so allowing them to keep their usual standard of personal hygiene, but giving them the choice of clothing, involving them in decisions relating to their own care. So this brings you to question number 1, which is asking you to describe skills needed to support the individual person-centered care needs. So you need to describe, and that means you need to write about each skill you identify and show you understand why it is needed, and you need to write in sentences. And here are some examples of qualities for person-centered care. So gentleness, so we need to be caring and gentle when giving personal care, because otherwise we may be too rough and we may hurt people. Empowering, so we need to promote independence as much as possible. For elderly, we need to maintain their level of independence, and for people with learning disabilities, we need to teach them independence in personal care. Other qualities needed. We need to be non-judgmental. So everybody is different in shape, in size. We have scars, different colour, different body hair, etc. As carers, we must be non-judgmental when helping others with personal care requirements, as we need to be professional. We need to be respectful. We must respect the wants and needs of people, as we all have preferences of what we like and dislike, whether it is how we want our hair or what soap we use, or if we do not want a full bath every day. It's really important to be respectful. And this brings you to question number 2. You need to describe qualities needed to support the individual person-centered care needs. To describe, you need to write about each skill you identify and show you understand why it is needed. And you need to write in sentences. And again, you can use some of the examples in the previous slides, but it's good practice to have a look and do some of your own research and look for some more ideas and examples. So over some of the sessions, we've looked at policies and we've looked at procedures, and we're going to look some more. And policies and procedures set expectations and proper ways of doing things. So they guide you day-to-day activities, and they help promote consistency in practices, they reduce mistakes, and they keep service users and staff safe. It's really important that you know your policies and procedures from the care environment that you're working in. In the care, you may cause harm to someone if you do not follow a procedure, and healthcare workers regularly deal with life or death scenarios, so it's really, really important that you know the policies and the procedures and keep yourself up to date with them. So this is just a little exercise for you to do, for you to have a read through these questions and have a think before you move to the next slide. Think of what the answers could be. So the first one, so what procedure must we follow when turning a service user in bed? What procedure must we follow to ensure we do not pass on germs from one service user to the next? What procedure must we follow to protect ourselves when carrying out personal care? What procedure must we follow when we are completing care plans? So as I say, for a moment, just have a think of the answers on there and then move on to the next slide where you will see what they are. So the procedure we must follow when turning a service user in bed is a manual handling procedure. What procedure must be followed to ensure we do not pass on germs from one service user to the next is the hand washing procedure. What procedure must we follow to protect ourselves when carrying out personal care? We need to protect ourselves, self-protection. And what procedure must we follow when we are completing care plans? And that would be the confidentiality procedure. Now, you will get training in all these procedures. You may go on short courses, you may have some training in staff meetings, in your induction. When you start at the setting, you will get told about these procedures also. And some of the procedures, as with policies and procedures, they change and they're updated. So, and you will need to have maybe an annual. So with manual handling, you need to keep on top of that training so you know exactly what the procedures are. And this slide talks a little bit more about what I just mentioned, but it's why we need to follow these procedures. And as I said, manual handling, so it's for health and safety. It must be followed so that the service users can be lifted and moved safely. It's all to protect yourself as well when you are lifting and moving. And we must be trained in the manual handling before we can move or lift a service user. So that's really important. If you start in a job role and you're asked to lift somebody and you know you've not had the training, you need to make sure you ask and tell people that you've not had the training. Hand washing is important during personal care because it supports infection control, it stops germs from spreading, including MRSA and obviously COVID-19, which is the current pandemic that we are experiencing. Self-protection, so we must wear personal protective equipment, which is often known as PPE, when dealing with bodily fluids to prevent the spread of contamination, including infections and viruses and COVID-19. And confidentiality, we must maintain confidentiality when completing care plans because the Data Protection Act and GDPR, that's there to protect the individuals. So what could happen if we don't follow these procedures? Well, with manual handling, if we do not follow the manual handling training, we can incorrectly use a hoist and hurt a service user or hurt ourselves or our colleagues. If we don't wash our hands properly between service users, we can spread infections and viruses to the other service users or to ourselves or our colleagues. And a breakout of COVID-19 may spread in the care home, which could cause serious harm or even death of service users or colleagues. Self-protection, so if we don't wear personal protective clothing when dealing with bodily fluids, we can get infected. The liability insurance will not be valid, and a breakout of COVID-19 may spread in the care home, which again could cause serious harm or even death of service users or colleagues. And the confidentiality procedures, so if you don't maintain confidentiality and write about another service user, the company will be fined and the individual will be disciplined. So settings where these procedures are followed could be a residential care home, nursing care home, hospital, rehabilitation unit, home care in the service user's home, a mental health unit. So you'll need to specify a setting for where the procedures are taking place when you answer the question. So think about the settings that are listed here. So this is question 3, and you need to identify 3 procedures relating to person-centred care that need to be followed at a setting. So remember to think about the settings on the previous slide and choose a setting. For each procedure, explain why it's important that it is followed. And remember to explain, you need to write in full sentences to create paragraphs, and you must also give reasons for your answers. So using joining words, which are conjunctions, and to do this you can use words such as because, and, therefore. The next few slides that you're going to be looking at relate to question number 4, 5, 6, 7, 8, 9, 10 and 11. And you're going to work on some case studies for the rest of today's work. You'll start by looking at an example case study of Jan, and her scenario is in your workbook, and also you'll find it on over the next few slides. So when you're looking at the case studies, what you're going to be doing, you're going to be looking at the personal care that is needed for each of the individuals, and you're going to be focusing on the physical care needs and the emotional care needs of each one. So for physical care needs, you need to think about washing and dressing, eating and drinking, toileting and mobilising, which includes walking and moving. So you're going to look at their individual physical care needs to see what support they might need to help them. When you're looking at the emotional care needs, you need to think about respect, privacy, dignity. Think about choices, think about independence and supporting their independence, and also think about their safety. Okay, so you'll be looking at a worked example of Jan, and we need to tailor the care to Jan to ensure the care she receives encourages her independence, but also meets her individual health and care needs. You don't need to write up about Jan. It's just an example to help you when you're looking at the other case studies and to see what kind of care and support Jan needs to help you with the others. Jan is 22 years old and has recently moved into a house share with another young female called Sharon. They have 24-hour care in their home via one-to-one support workers who work shifts. Jan goes to college every day. Jan has Down syndrome and she needs prompting to go to the toilet, to get up, to get dressed, to get showered or bathed, to eat meals, to cook, to clean and to go shopping. She lacks independent skills, but the staff are trying to teach her to do things for herself. Jan is Jewish and celebrates her religion at the local synagogue with her family. She celebrates the main festivals such as Passover, Rosh Hashanah, Yom Kippur, Sukkot and Hanukkah. Jan only eats kosher foods. She also loves Diet Cola. She is currently learning about healthy diets and wants to eat and what to eat. She does not like fruit or vegetables and prefers chocolate and crisps as snacks. She is overweight due to her poor diet and needs support to make better choices without losing her independence of having a choice in her meals. Jan doesn't like getting showered and often refuses to get a wash, so she needs lots of encouragement. She has full support with money management. Due to Jan's learning disability, she often has no concept of danger in her new home, with items such as wires, plug sockets, the cooking equipment, the temperature of hot water in the tap, and the need to support, and she needs support in these areas. Jan is fully mobile and can walk. Jan's favourite activity is going out on her tricycle with her support worker. Jan has a shunt fitted which drains fluid from her brain. This sometimes gets blocked and is a medical emergency when this happens. So from reading Jan's story, her personal care for eating and drinking, so she needs support to make better food choices as she only eats chocolate and crisps and does not like fruit or vegetables. She only eats kosher food because of her religion. Jan is overweight due to eating and drinking unhealthy foods, so she's currently learning about healthy foods but needs support in doing this. She needs support in making good choices while trying to keep her independence. So to keep Jan safe, she has no concept of danger, so needs support with areas in her house. She needs educated in safety, like not answering the door. She also needs to be taught about the dangers of wires and shown how to use plug sockets, cooking equipment and the temperature of water in a safe way. Jan needs prompting to go to the toilet. This supports her personal care. She needs to be reminded and motivated to use the toilet and for her to go independently. She needs teaching how to keep up with personal care and she needs to be encouraged independence in these areas. Jan needs prompting to get up, get dressed and showered or bathed. She needs lots of encouragement to get washed and dressed. She needs motivating to get up. And, you can motivate people in many ways. And for one way, for Jan, it could be by telling her what she could be doing during the day to tempt her to get up. You could talk about her pedal bike. She enjoys that, so you could talk about that. Jan is fully mobile. She can walk and she loves going out on her trike. Her support worker goes out with her when she rides her trike. She has the shunt fitted and this drains fluid from her brain and you read it sometimes gets blocked and if it does it's a medical emergency if this happens, so you need to be aware of this. She needs ongoing supervision to support her if the shunt gets blocked. Okay, so we're now looking at emotional care of Jan. So respecting her religion. She's Jewish. She celebrates her religion at the local synagogue with her family. So she needs the opportunity to go to festivals such as Passover. She celebrates the main festivals, so needs to make we need to make sure she knows what they are to help her to keep her faith. Other parts of her emotional care, we need to promote independence. She needs to be supported and encouraged to do things on her own. She needs support workers to work with her and praise her, to encourage her to be motivated for everyday tasks like cooking and cleaning. Jan needs to improve her independence with toileting and everyday hygiene, and this will improve her self-esteem. So, by giving praise and promoting her independence, that will support and encourage her to do things herself. So it's your turn now. So you need to read the rest of the case studies, and for each of them, you're going to plan the care for that service user. So you need to think of all aspects of their personal care, their emotional needs. Think about the example of Jan, so that will help you if you're unsure. When you're reading through the case studies, maybe use a highlighter pen, a pencil pen, underline or highlight the personal care, the personal care needs of those of each of them. So the case studies, there are two children. So child 1, Valentina, which is question 4 and question 5. You've got child 2, Jeremy, which is question 6 and question 7. You've got an adult, who is called Moses, and that's question 8 and question 9. And then you have an elderly adult who is called Doris, and that is for question 10 and question 11. And it's important for each of your answers that you describe using at least 3 sentences the emotional needs of each of the case studies, and describe using at least 3 sentences for the physical needs of each of them as well. This brings you to the end of the session, and now you've completed the session, you should be able to describe skills and qualities needed to give personal care. You will be able to identify procedures relating to personal care. You can explain why procedures relating to personal care must be followed, and you have looked at case studies, and you will be able to describe the personal and emotional needs of individuals of varying age groups, including children and adults.